Hello, my name is Dr. John Bertini. I'm a urologist who has been in practice for over 35 years. In my experience, one of the greatest challenges a young physician can face is starting a practice. Establishing and running a successful practice requires knowledge and a set of skills you may not currently possess. That is why we are excited to present the Business of Medicine video series. From setting up your business plan to getting financing, this series will provide you key information and guidance on how to set up your practice and keep it running. With that being said, we hope you'll enjoy this series. Thank you.
Welcome to our Business of Medicine series, and I want to welcome our HCMS president today, Dr. Dexter Turnquist. Welcome.
Thank you. It's a pleasure to be here.
Absolutely. We're going to talk about the business plan and how you implement it. The first question is, what steps did you take when creating the outline for your own business plan? When did that start?
So it's very important to start very early in your career and determining what practice setting do you think you might want to work in. So there's a learning process that has to happen along the way, and there's some vital steps that need to be made. So very early on in my residency, I kind of determined what it is I thought I might want to do, and being in private practice, being solo practice, was what I thought was the right thing to do. And when I started, certainly the times were a lot different than they are today. So it was a much more simple discussion, I think, at that point. But the first steps in setting up a practice or even exploring private practice is to actually go out and talk to people who are doing it.
Makes sense.
And so essentially that's where I started.
Okay.
Talking to people who were actually practicing medicine at this time.
For me, my decision was made more based on location. A certain part of town that I wanted to be in was more conducive to a private practice type of location. And there was already an existing practice that covered most of the area that I wanted to be in. And so that worked out very well for me to join an existing practice and also a private practice as well.
What are some of the key parts of creating that business plan?
So the very first thing that needs to be determined is, where do you want to live?
There you go.
All right, that is the most important thing. Location.
And
Right.
You usually decide that after a residency, yeah?
Correct.
Okay.
It's not just about real estate, it's also in practice. So in determining where you set up your practice, you want to set up your practice somewhere where you're comfortable.
Okay.
So most of us will venture not too far from home, as in usually where you finish your residency is a good place to start because you know people. You've set up a network of co-residents. Additionally, tapping into things like the Harris County Medical Society.
There you have
CMA.
it. And those resources.
So I was active in those things even as a resident. So I had another set of people that I could mingle with. But yeah, it's really about the networking and determining where your people are. It sounds fairly daunting when you really think about it, but it's not really if you've done a little bit of a groundwork.
So I think when you're deciding about a location, you're really asking yourself the question of, where do you want to practice? Do you want to practice in a certain area, or do you want to live in a certain area and then figure out your practice based on that? And so I think that was the first decision for me, was trying to figure out where I wanted to be. And based on that, I had moved away for residency. And so for me, I actually wanted to move back home, which was to Texas. And so that's how we decided kind of the basics of where we wanted to be for practice.
If I wanted to move to a new town today, first thing I would do is go there.
Yes.
I go there, I find out who's there. I'm going to do a little research about what my competition looks like. Are there 40 surgeons in this little town, or is there like 2? So first thing is determining where you want to be. And again, that boils down to your comfort zone. Big deal in determining where you're going to set up your practice. Find your community.
How did you decide on hiring your staff? Because it takes the staff to run this office.
So it's critical to have a good staff. You need at least one person that you can depend on in your office come all the troubles that are going to come your way. You need one person that you can rely on.
Okay.
So it's very important that first person that you hire, is knowledgeable, but more importantly, enthusiastic. Coming straight out of a residency program, you want somebody who knows the business a little bit. Your office manager, because that's the person who's going to get the business done. So once you have those two building blocks in place, you're ready to go. So first step is to get yourself a Medicare number, and there will be somebody, another series that'll talk about credentialing specifically, so I won't get into too much detail about it.
Okay.
However, in getting on plans, the first plan, the easiest plan to get on is Medicare. Get your Medicare number as soon as you can get your Medicare number.
Okay.
So you need to get a Texas medical license, which you're entitled to have as soon as you graduate medical school. You can apply for a Texas medical license. Insurance.
Oh, yes.
Right? We've got to be covered.
Yes.
Right?
Liability insurance.
Liability insurance.
Exactly.
Again, fortunately, being a member of Texas Medical Association, fantastic organization, part of that comes TMLT. Very reasonable rates for people who are starting practice. So now you have your license, you have your credentialing with Medicare, you have your insurance going. Having a good accountant, crucial early on. A good accountant will help you with your business plan. They will tell you when you're going underwater. You got to do something different.
We don't want to hear that either.
Right?
Yeah.
So it's the ebbs and flows of business.
Absolutely.
Right?
Yeah.
Sometimes you're doing great, sometimes you're not doing so great, and balancing those things out is important. You want to make sure that you've built your practice for the hard times, right? Because again, it's you and your family. You have to have contingency plans, all right?
There you go.
And again, when you're working for yourself, it would be nice to say that once you open your door and hang your shingle, people are just going to beat down your door. It doesn't work that way, right? You have to build a reputation. And so you have to, when the good times are good, enjoy them, but make sure that you're prepared for when the ebb comes, right? Eventually it all balances out, and then you run at a steady pace, and you can't predict what's going to happen month to month. But you want to make sure that you set yourself up for success.
I'm going to now turn it over to Miss Pam Potter with Houston Methodist, and she's going to go over the how-tos of credentialing your practice. Thanks for joining us today, Pam.
Well, I appreciate the invitation.
So let's go ahead and get started with all these questions. So when you were starting out to understand the credentialing aspect of your practice, what were the things that you initially had to think about in order to go down that road?
When you think about credentialing of practice, there's probably just quite a few things that you have to put together to understand where you need to go. And the first thing that you have to do is, number one, get all the credentialing information together so that you can credential with Medicare, with Medicaid, with commercial, whatever you choose to. So, having that checklist and everything together makes the whole process easier. And we can go into that a little bit later. But to answer your question, then you have to look at who do you need to credential with? What's your specialty? Who's your patients? And that that's probably something that would have been looked at in the marketing and planning in your business plan. But, that's going to set that direction on who you need to credential with, who your competitors are, and then also, what kind of insurances are in your area, who's the employers, that type of thing. So you have to put that whole package together to just know who you need to be with and what types of patients and who you want to credential with.
Can you now provide us with an overview of when starting up a practice from the licensing aspect of it and getting your practice an LLC or an individual, providing an overview as to what is necessary for a physician to think about when opening up their own practice and going on their own?
Well, I think the number one thing, what kind of entity are you going to be, is kind of the question you have to ask yourself. Is it an LLC? Is it an S Corp? Is it a C Corp? When you decide that, that's something that you really can't go back and easily change, right? And there's legal aspects and also tax implications for each of those choices. And everyone's, got a different a focus and a different need. And so it's really important to get that professional help at that point in time, just because it's such a long-lasting decision.
What should they be on the lookout for related to the MAC and CMS? And what are some of those areas within CMS that they really need to be aware of to ensure that they are filing for the appropriate Medicare numbers?
Being a federal program, you don't go and just credential with Medicare. Medicare has what they call your Medicare administrative contractors, and they're the third-party administrator that follow the rules of Medicare and follow Congress's direction, because that's who's over Medicare and HHS, and then they will actually be the ones that you work with to credential. Here in Texas, we have Novitas. We have each state, who actually you would link to be with them. However, in Texas also, there's two companies, but CGS is the company that does DME. So if you happen to be in a specialty that needs DME, then you want to get further credentialing besides just the Novitas in Texas. When you look at your commercial products, this is where you really have to look at your immediate area. And because just to sign up for everything, just so you'll be on everything, is probably not a wise decision. There'll be marginal plans out there where, it's hard to follow their rules. And, you can end up losing money on those type of accounts if the rules are real onerous, or if it doesn't, if you're going to insure 100 patients in a whole county, you're going to mess up on those patients, right? You're not going to follow the rules right. You're not going to understand it. They're going to slip through the cracks. So anytime you want to credential with a managed care plan, you want to make sure that it's, one of the national plans. Okay. And then, but really study the local plans and make sure that they're right for your practice, for your type of patient, and keep them on board to make sure that they can bring you the volume of patients, right? For giving them that discount that you're going to be giving them off of your billing.
Well, thank you so much for taking the time today to speak to us on the credentialing process. We appreciate your time with our video series.